I'm Lou Carta of the Middletown Health Department, and this is Healthline. Chiropractic care was once thought to be a strange and mysterious way of treating disorders of the musculoskeletal system. But now it's recognized as a natural method of healthcare that focuses on the causes of physical problems rather than just treating the symptoms. Dr. Rob Shortell is here to explain how a normally functioning spine and healthy nervous system helps your body to better heal itself. Welcome to Healthline. Returning to our program, it's been a few years, is Dr. Rob Shortell. Dr. Shortell is chiropractor with Cromwell Chiropractic Center. Dr. Shortell, thank you for joining us again.
It's a pleasure. I always admire Mr. Carta here. He's been dedicated towards the health of Middletown for almost 3 decades here, somewhere a little more, a little less in that zone. And he not only does his 40 hours within the job, but I see him on the weekends dedicated to things such as Kids Day and at different events late into the night that help the citizens of Middletown. So it's an honor to be with somebody who not only does their work, but does it exceedingly well for the benefit of not really himself, but the citizens in this area.
Thank you. And that was a paid-for political... No, I'm only kidding on that. Thank you very much. I appreciate that. But let's talk about your back, your spine. That's why you're here. Tell us a little bit about what a chiropractor does. A lot of people still have suspicions about chiropractors, not like it used to be, but they wonder, are they doctors? Will they hurt me? Talk a little bit about what the profession is all about.
So ideally, what chiropractors try to do is identify the 3 main causes of health or illness, those being physical reasons, chemical, and mental reasons. Now, when you talk about chiropractic physicians, we're the number 1 leading physicians in natural health in regarding to this, and we're well trained to do this. We have comparable education to medical physicians. We just have different stresses. We stress more the spine, public health, neurological system, where they have more of a stray towards pathology and microbiology, among some other things.
When you talk about natural health, define that. How is that different from medical?
So I define, just like the dictionary does, health is a state of optimum physical, mental, and chemical wellness, and not merely the absence of disease or infirmities. Because when we deal with the majority of people's idea of what health is, it's really the absence of pain. And that is what our traditional health system deals with. It tries to reduce pain in individuals. But in reality, what people are doing, if you notice, we continue as a country to get lower and lower as compared to other countries in the world in overall health scores. And, just recently, last year, they found that actually in the United States, people are living less. They're living shorter than they did the previous generation. So the United States has a very outside-in, artificial, chemical way of trying to make people healthy, and it's not natural. And our bodies are suffering for that.
And as a chiropractor, tell me, is there such a thing as a typical person, but who would come to see you?
Typically, the majority of people come in to see me are people who are suffering with pain or discomfort, headaches, neck pain, lower back pain, disc problems. But like I like to explain to them is, like I said before, there's 3 stresses on your body: physical, chemical, and mental. And so when they come into the clinic, I say 10% of your problem is in your neck, causing your headaches. 10% of your problem is in your lower back, causing lower back pain or sciatica. 10% of your problem is in the disc, that it's herniated, causing your pain and problem. 90% is its influence on the brain. So when you have altered or stressed influence on the brain, like I said, for physical, chemical, and mental reasons, 3 natural reactions occur. The first is when your brain is under stress, it causes us to adopt a flexed or protected position. So what does that mean? Your head comes forward, your shoulders come forward, and most people nowadays say, my goodness, I have bad posture. What can I do about it? Well, posture is an unconscious mechanism. You don't consciously control posture. Your body just does it automatically, just like it does with your heart rate, with its respiratory rate. So if you could figure out which one of those 3 or all 3 of those stresses are causing your problem or stress on the brain, your body will naturally stand taller. It will naturally bring its head back over its shoulders. Number 2, when you have too much stress on your brain or your system, a second thing occurs. And what that is it causes an influence on your hormone system. So an altered influence or a stressed influence on your hormone system causes the shutdown and reduction of 3 main body systems. The first is digestion. And most people know that with problems such as heartburn or reflux or they have altered bowel patterns such as constipation or diarrhea or IBS. Number 2, it alters your reproductive system. So in ladies, it makes getting pregnant and staying pregnant more challenging, and it alters the sexual experience both in men and women. The third system, what it does, is it knocks down your immune system. So when you reduce your immune system, it allows people to feel more run down. They're more open to getting bacterial, viral infections. And over the long term, it leaves them more susceptible to 3 types of things. Cardiovascular disease, so that's heart attacks, heart disease, stroke. Number 2, cancer of all types. And 3, autoimmune disorders. The last of the third, when you have stress on your nervous system in your brain, is it causes inflammation in your body. So how does it cause inflammation? Well, it releases chemicals. One of the ones that's most well studied is something called cortisol. And when you release cortisol in your body, it increases the inflammation titer in your body. It's kind of like having a sunburn and somebody touches your skin and it hurts. So where your joints are having problems the most, where they're most degenerated, where they're most weak, what happens is you will feel the symptoms in that area. So for some people, it might be in the lower back. For some people, it might be in their neck. The other thing is what it does is it causes inflammation on the brain. And that's where it has its most problematic effect. So usually you tend to see a couple of things happen. The first is it alters the way the brain performs. So what I say is they get cognitive impairment. So they don't think as clearly. They don't do mathematics as cleanly as they used to before. They have trouble putting a name to a face. They have trouble just generally using the brain. They sometimes feel like they're in a fog. Number 2 is it also has a tendency to influence mood. And I typically find it's a left brain problem. People have a tendency to feel more down or depressed, or the symptoms of feeling down or depressed. If they have a more right brain concomitant, they typically have the problems with feeling stressed or anxious, the symptoms of these type of things. So when you take in the totality of how to improve somebody's health, I find as a chiropractor, the best solution is typically not in a pill. It's not in an injection. It's not in a surgery. It's in you're teaching yourself how to use your body more correctly in those 3 elements, physical, chemical, and mental. Now, with saying that, I don't want to disparage my medical colleagues. I'm friends with many, neurologists, and orthopedists, and radiologists. We have a wonderful system here in Middlesex. Middlesex Hospital does a terrific job. But I believe they do a wonderful job at emergency medicine. If I have a heart attack, if I've been shot, if I've been stabbed, if I have cancer, this is emergency medical care, which the United States by far is superior than any other country in the world. But when we talk about health care, the United States is falling back quicker and quicker every year of many, many countries. And that's where chiropractic comes in. If people exercise a more wellness-based approach, we would live longer and happier.
So when you see a patient, is there a course of action that you would normally undergo when somebody sees you in an evaluation first, and then is there a typical a course of treatment? Because many people, I think, today still think as chiropractors as backcrackers and still have some misconceptions.
Yeah, it's you opened up by calling us strange and backcrackers. So, and that's fine. It's just a different approach because we've been taught. I grew up in a medical-based family where when I got sick, I went to our family doctor, and oftentimes he gave me a medication to theoretically help me get better. Back in the day, my grandparents saw the same person I did. My parents saw the same person I did. All the kids. So we had a family doctor. Now it's become much more specialized, and I think that's not always the best thing. Because when I walked into this doctor's office, he knew my whole medical history because he knew my grandparents, he knew my parents, he knew my uncles, and I had a very good relationship with him. So it wasn't a negative experience.
You're listening to Healthline. Our guest today is Dr. Rob Shortell from the Cromwell Chiropractic Center. We're talking about treatments of the spine and just adjustments and manipulations. Tell us a little bit about adjustments and manipulations. How are they performed typically?
So to get back to your statement regarding the 3 stresses, physical, chemical, and mental. So how do we address those? Physically, we do a complete physical examination where we assess the full balance, strength, flexibility of an individual. And we also will follow up with computerized x-rays to assess exactly where their body is and how it's functioning and where their weak points are. Then what we use physically is we use a procedure called adjustments. So for some people think of it as pushing on the spine and making that popping or cracking noise. We do that in our office, but we also have very gentle instrument adjusting, so we can work on people who have significant osteoporosis safely. So that's how we would deal with it on the physical basis. From the chemical basis, we'll discuss people's nutrition with them. What are you eating? What are you supplementing with? Your hydration, your diet. And I find the best way to deal with that is I assess somebody's blood type. And once I know their blood type, be it A, B, or O, I can make recommendations with people, because if you deal with certain people, they deal very well with vigorous exercise. These people deal well with a ketogenic diet, which is typically a heavy protein diet and a low carbohydrate diet. Some other people do beautifully well with meditation and Tai Chi and yoga and a soothing environment. And these people have a tendency to be more vegetarian-based, where they really shouldn't ever not eat red meat or pork. The third aspect of what we deal with is the mental aspect. So during the examination, part of that examination is assessing the neurological system through, standardized neurological examinations that your neurologist or your orthopedist or your primary care physician would do. But we also take it a notch past that, and we used advanced neurological training. And one of the best ways we assess people is with computerized testing of the brain, where we see how is the brain physiologically functioning in real time. And based on that, we can make recommendations on how this person can live in a more pleasant way. Because when we deal with the brain, human beings are the most evolved mammals neurologically of anything on Earth. We're blessed with what we call a cerebral cortex. And most people, that's what they think of the brain, the top of the brain with the little bubbles and infolds and stuff like that. And then underneath that, you have a very powerful, what we would call a limbic brain. So your limbic brain deals with all your subconscious activities, all your memories, all your learned behaviors. Now, this part of your brain, it will take in about 40 million bits of information per second. Your cerebral cortex will take in about 40 bits per second. So your subconscious automatic brain is about 1 million times stronger than your conscious brain. So this is where we get into where people have a difficult time breaking habits that they've done for years. You say, look, I shouldn't eat the donut. I shouldn't eat the donut. And then what do? The next thing, you eat the donut. So why that is your patterns of behavior and your memories are so hardwired, it becomes automatic. It's kind of like walking down the street. You don't even think about it anymore.
So can you break that pattern?
Yes, most definitely. People can break that pattern. And when we can use the computerized testing of the brain, it assists us in seeing where is the weak point in this person's brain. Now, everybody's wonderful and beautiful, but everybody has weak points and Achilles heels. And so sometimes our brain is causing us to do things that we're not even consciously aware of. And so what this does is assist me in seeing where that is and how to help them.
And if people want more information about your practice, or just chiropractic medicine in general, how could they get hold of you?
Sure. My name is Dr. Rob Shortell. My office is in Cromwell, Connecticut. But I'd rather leave you on 3 tips. So what are 2-3 things that a listener can do to help themselves starting after this? Well, number 1, physically, everybody needs to move their body. People move their body much more, 100 to 200 times more 100 years ago than they do now. And when you move your body, it relaxes certain parts of your brain, and it relaxes certain parts of your chemistry in your body. So everybody needs to move their body every single day. Number 2 is nutrition. Like they say with computers, garbage in, garbage out. Most of our society is so heavily laden on carbohydrates and refined carbohydrates that it's causing inflammation in our body. It's causing our brains to work incorrectly. It's causing our bodies to work incorrectly. The third thing is, how do you help your brain? I call it 3-3-3. So you can live in the past, you can live in the present, you can live in the future. At the end of each day, try to think of 3 pleasant things that happened to you over the course of the day. Number 2, try to think of 3 things currently you are feeling in the present, whether it be how nice your socks feel or how comfortable the blanket is. 3 things in the present. And the third thing is to think of 3 things in the future, starting tomorrow, you're excited about doing.
An interesting approach. And thank you, Dr. Rob Shortell, for being our guest today on Healthline. Healthline is produced by the Community Health Education section of the Middletown Health Department, which is solely responsible for its content. Please join us again next month at this time for another edition of Healthline.